Hi, my name is Rebecca Bowers. I'm a registered nurse currently enrolled at Eastern Kentucky University in the Psychiatric Mental Health Nurse Practitioner program. And the purpose of this integrated review presentation is to examine if physical activity is indeed a viable treatment for depression through meta-analysis, quantitative and qualitative studies to determine if healthcare practitioners can safely implement physical activity to manage depression. Depression is one of the greatest significant public health crises affecting the world. According to World Health Organization, depression affects 264 million people globally. Depression can lead to death and is a main contributor to overall global burden of disease. The World Health Organization states by 2030, depression is expected to be the disease with the highest burden everywhere in the world. And depression not only affects the individual, but the family and community by loss of productivity and unemployment. The Center for Disease and Prevention Control reports there are effective pharmacological and psychological treatments for depression, one being physical activity. And due to the millions of individuals who suffer from depression, identifying the right treatment is crucial. Pharmacological therapy is routinely ordered. However, there is evidence of cognitive behavioral therapies such as physical therapy that can improve the symptoms of depression. The theoretical framework I chose is Nolan Fender's health promotion model, which is a middle-range nursing theory focused on individual behaviors and the inner desire to increase well-being and good health. The individuals who choose to use physical activity as an intervention utilize Fender's model by their preconceived ideas of the benefits and anticipated positive outcomes to promote better health and reduced depression symptoms. This presentation will highlight 3 research studies that support the concept of physical activity as a viable treatment for depression. The first is a meta-analysis by Kaflam, Kleppe, Nordus, and Hyland in 2016, and the quantitative study is Helgedotor, Bijor, Helgren, Matz, Ekblom, Orjan, Forshell, and Nivan in 2016, and the qualitative study is Shear, Calnan, Lewis, Campbell, Taylor, Turner in 2011. The meta-analysis. The aim of the study was to determine the relationship between physical activity and depression. It was a blinded group allocation, blinded outcome, and intention to treat analysts to describe the validity of the individual studies. It was 23 randomized controlled studies, 977 participants, and they were 18 years and older. The search strategies was literature and the Cochrane Library, PsycInfo, INBIS, Midline, Central, and sports article published until November 2014. The data analyst was a comprehensive meta-analysis version 2. The statistical measurements used was a Beck Depression Inventory, the Center for Epidemiologic Studies Depression Scale, Hamilton Rating Scale for Depression, SCL-90. And the study findings showed moderate to significant effect. And the conclusion is exercise as a standalone treatment for depression has shown great effectiveness in reducing the symptoms of depression. The recommendations is further studies should focus on identifying the different types of exercise to prove how exercise can be tailored to each patient. The quantitative study. It was a single-blind, parallel, multi-centered, randomized controlled study. And the participants are 18 through 67 of age. And analyst used is Chi-2 test and one-way analyst of variance and STATA 14.1. The measurements used was a mini international neuropsychiatric interview mini, and that was at baseline, and post-treatment using Montgomery-Åsberg Depression Rating Scale. And the findings were the effect sizes were almost identical across all exercise groups compared to the treatment as usual. However, the largest effects were seen in the light exercise group. The conclusion is exercise showed more effect at reducing depression symptoms compared to treatment as usual. The recommendation is to incorporate exercise into a treatment plan to manage and control the symptoms of depression. The qualitative study is a study with the aim of exploring individuals' perceptions and views of physical activity for the treatment of depression. The sample is 33 participants, ages 18 to 69. The data collection was transcribed. It was auto-recorded, transcribed verbatim. The transcripts were read and reread. and 3 of the researchers met to discuss the transcripts and how they were analyzed and interpreted. The data analyst, the transcripts were analyzed and coded using atlas.ti. And the results were most participants viewed physical activity to be an allowable treatment for managing depression. The subjective data implied physical activity could enhance moods, give a sense of purpose, and reduce negative thoughts. And the participants' quotes were further evidence that general well-being, being energized and elevated, sense of purpose, and a distraction of negative thoughts were brought on by physical activity. The recommendation is offering structured group-based physical activity programs would be beneficial in managing depression symptoms. And these 3 research studies proved that physical therapy can be implemented by physical exercise compares favorably to no intervention and usual care for depression. Exercise is comparable to psychotherapy and antidepressants. Physical activity can be a viable standalone treatment for depression. And then based on the participants' feelings of overall well-being, improvement of self-esteem, and a decrease in depression symptoms, physical activity could safely be carried out in any environment. So physical activity as a standalone therapy can be implemented if the patient has no contraindications and the physical activity or the exercise plan have been discussed and agreed upon beforehand. And then the physical activity can be done in a group or individual setting, and adopting a physical activity program where the individuals can log their time in at home or participate in a group program in the office would benefit all involved. And this would benefit both the patients who self-isolate and the patients who like to socialize. And the physical activity can be modified for everyone to accommodate for physical limitations and disabilities. And it could be the setting for implementing this activity. Implementing a physical activity or exercise regimen can be initiated in the home or office, then transition to a community setting or home to safely manage depression. And physical activity therapy could be implemented as recreational therapy daily, weekly, or monthly. And individuals would be able to walk and exercise anywhere, not just in the gym and controlled environment. My name is Rebecca. If you have any questions or want to discuss this further, you can email me at forbeckbeck@gmail.com. Thank you.